Good morning, everyone. Today, I'm here to read the chapter Drugs and Medicines. The association of mankind with pain and disease is probably as old as man himself. Humans have always been looking for remedies to overcome their pain and sufferings. The earliest attempts at this involved use of various plants. The knowledge was based on experiences and was handed on from generations to generations. It is being used even today. In an attempt to conquer pain and disease, a large number of synthetic chemicals have been discovered. The chemicals used as medicines are known as pharmaceuticals. Today, pharmaceutical industry has grown to be one of the biggest industries in the world. In this lesson, we will try to introduce you to the area of the drugs and medicines. In the process, we would attempt to differentiate between drugs and medicines, though commonly used interchangeably. You will also learn about classification of medicines and other important aspects of drugs and medicines. Objectives. After reading this lesson, you will be able to define drugs and medicines, differentiate between drugs and medicines, classify medicines on the basis of their action, cite examples and efforts of effects of analgesics, antipyretics, antiseptics, disinfectants, antacids, antimalarials, anesthetics, antimicrobials, anti-fertility drugs, etc. Differentiate between analgesics and antipyretics. Differentiate between antiseptics and disinfectants. Explain habits forming and non habit forming drugs. Differentiate between broad spectrum and narrow spectrum antibiotic. Differentiate between local and general anesthetics. Describe self medications and alternate systems of medicine. What are drugs and medicines? When we fall ill, we take some tablets, pills, injections, or apply some ointments to get well. All these are collectively known as medicines. Sometimes we may use some parts of plants or some preparations made from herbs, minerals, animals, etc. All these substances used for the treatment or prevention of disease can also be called as medicines. Medicines contains a single chemical or a number of chemicals in different amounts to have a desired effect. The mode of action of the chemicals of a medicine is quite varied and complicated. In many cases, mode of action may not be fully known to us, but we continue to use them as they are useful to us. Early men used several plants or parts of plants to cure diseases without knowing of the chemical components responsible for it. For example, bark of willow tree was used for relieving pain as analgesic. Later, it was found that its bark contained 2-hydroxybenzoic acid, which is closely related to enzyl salicylic acid, also known as aspirin. Parts of the plant Rovolfia serpentina, Hindi name is Sarpgandha, have been used in Ayurvedic drugs for the treatment of hypertension, high BP, that is known as blood pressure. Later on, it was discovered that a compound called reserpine was responsible for reducing blood pressure. Thus, reserpine became the first modern medicine to control blood pressure. In most of the cases, nature led to the discovery of modern medicine. Thousands of chemists all over the world are constantly searching for better, efficient, cheaper, and safer medicines. As mentioned earlier, the term drugs and medicines are used interchangeably, but there is a difference between the two. Let us try to understand the difference between the drugs and medicines. The term drug is often used for preparation or formulations whose chemical components and their quantities are not fully known. These may be extracted from certain plants, herbs, animals, parts, or maybe minerals. The term medicine is used when the chemical composition of the quantities of various chemical components are known. Further, the effects of the chemical compounds present in the medicine and their side effects have been properly and extensively studied. The medicines are approved by the relevant government authorities like Drug Controller of India. The term drug is also used for substances which are habit forming and are often abused. For example, narcotics like cocaine, morphine, heroin, marijuana, etc. As you read in newspapers, terms like illegal drug trade, drug trafficking, drug mafia, drug peddlers are used to refer to illegal dealing with habit forming substances, referred to as drugs. However, the difference between drug and medicine is far from clear. Classification of medicines. You may be familiar with some of the common medicines used for relieving pain, reducing fever, or for treating common cold, etc. The number of medicines is very large, therefore, medicines are classified according to their action or use. Table 30 provides a list of some important classes of medicines. The terms like analgesics, antibiotics, antiseptics, etc. are common household words. Let us try to understand the meaning of this classification in a little more detail. Antipyretics reduce body temperature, antihistamines reduce allergy, analgesics reduce pain, antimalarials used for treatment of malaria, germicides kills germs, antiseptics kills germs, can be safely used on living tissue, disinfectants kills germs, cannot be used on living tissue, antacids reduce acidity in stomach, anesthetics, loss of sensation, antimicrobials, sulfur drugs and antibiotics, kills microorganisms, tranquilizers and hypnotics, reduce anxiety and brings calmness, birth control medicines, that is contraceptives control birth. First is antipyretics. Antipyretics are the substances which are used to reduce body temperature or to control fever. The word antipyretics is derived from the pyro, which means fire, means hot. Anti means against. Thus, antipyretics means it counteracts heat, high body temperature. Aspirin, paracetamol, and phenylacetin are commonly used antipyretics. You get them in the market with different trade names like crocin, anacin, dispirin, etc. Aspirin is the most popular antipyretic in use. It gets hydrolyzed in stomach and salicylic acid is released. Overdose and using it over a long period of time may cause side effects. It may cause bleeding in the stomach wall and even ulcer. Therefore, overdose and prolonged use should be avoided. However, calcium and sodium salts of aspirin are more soluble in water and are less harmful than aspirin. Analgesics. Analgesics are the substances that reduce pain, which may be due to swelling of tissue, injury, inflammation, or some other disorders. Analgesics are of two types, namely narcotics and non-narcotics. Narcotic analgesics are the ones which reduce sleep and thus help to reduce the feeling of pain alkaloid present in opium, viz. Morphine, codeine, etc. are common examples of narcotics. In higher doses, these may cause unconsciousness. These are habit forming and cause addiction. Due to the addiction, a person wants to have it regularly and in large amounts. Such a person feels upset and uncomfortable if he doesn't get it. Narcotic analgesics do not induce sleep and are not habit forming. A common example of this type of narcotic is morphine. Third is antimalarials. Antimalarial medicines are used to treat malaria. Quinine or chloroquine are widely used antimalarials. Quinine is one of the earliest drugs which was first obtained from the bark of the plant Cinchona and later on synthesized in laboratories. Fourth is antihistamines. Some persons are hypersensitive towards some medicines like penicillin, sulfur drugs, and may be sensitive to food and environment due to different sensitizing substances, that is, antigens, derived from them. The hypersensitivity is called allergy. It is due to release of a chemical substance called histamine in the body. And Antihistamines are the chemical substances which control or abolish the effects of histamines released in the body. These drugs are also called anti-allergic drugs. Histamine is also responsible for the nasal congestion, discharge, mild asthma associated with common cold, cough, allergic response to pollen grains, etc. Histamines contract the smooth muscles in the bronchi and gut, relaxes other muscles present in the walls of fine blood vessels. Antihistamines are widely used for treatment of hay fever, itching in eyes, nose, and throat, conjunctivitis. Some antihistamine drugs are diphenyl, diphenhydramine, Benadryl, pheniramine, maleate, avil, chlorpheniramine maleate, that is Zect, citrazine, and terfenadine, that is Sildin. Fifth is germicides, disinfectants, and antiseptics. Germicides are the chemicals which prevent growth of germs. Germicides are classified as antiseptics and disinfectants. Both kill microorganisms, but the difference lies in the way we use them. Antiseptics kill microorganisms and are safe to be used on living organisms. Antiseptics are used on wounds, cuts, and skin abrasions. These are used to dress wounds, etc. For example, iodoform, CHI3, tincture of iodine, ethyl alcohol, a 0.2% aqueous solution of phenol, and boric acid, H3BO3, are common antiseptics. Some dyes have the ability to kill microorganisms. These dyes were the earliest compounds to be used as antiseptics. Examples are acryflavin, a yellow colored dye, mercurochrome, a red colored dye, methylene blue, a blue colored dye. These dyes are still in use as antiseptics. Iodine is a powerful antiseptic. It is used as tincture of iodine. Tincture of iodine is 2 to 3% solution of iodine dissolved in ethyl alcohol. Iodoform is a yellow colored solid which is used as an antiseptic. Disinfectants kill germs, that is microorganisms, but are used on non-living substances like surgical instruments, floors, bathrooms, laboratories, etc. Disinfectants are the harsh and are not safe to be used on living beings as disinfectants can damage living tissue. Chlorine is a powerful oxidizing agent. It is used for disinfecting water. A concentration of 0.2 to 0.4 ppm parts per million is enough to kill microorganisms present in the water. Low concentration of sulfur dioxide is used to kill microorganisms in jams, jellies, and squashes. Thus, it acts as a food preservatives. Sulfur dioxide is used for fumigations in rooms, operation theaters, etc. to sterile them. Bleaching powder, CaOCl2, chlorine, mercury chloride, sodium hypochlorite, sulfur dioxide, etc. are the other examples of disinfectants. Is phenol antiseptic or disinfectant? It is an interesting note to note that 0.2% aqueous solution of phenol is used as antiseptic by making it is safe to be used on living tissues in low concentrations less than 0.2%. If the concentration of phenol is high, then it can damage tissues. Therefore, at higher concentrations, 1% or more, phenol is used as disinfectant. Here are the structures of phenol: chloroxylenol, orthochlorose, metacresol, paracresol. Most antiseptics and disinfectants are powerful poisons. They are able to kill microorganisms as they interfere with the metabolism, while some others are able to kill microorganisms because of their powerful oxidizing or reducing nature. So let's see nature of some important antiseptics and disinfectants. In first portion is poisons, then oxidizing agents, then reducing agent. Firstly, see dyes. Acryflavin, a yellow dye. Bleaching powder, poisons. Let's see firstly poisons. That is dyes: acryflavin, a yellow dye; gentian violet; then mercurochrome; then methylene blue. Phenols: phenol, cresols, resorcinol, chloroxylenol. Others: formaldehyde, boric acid, mercury chloride, silver nitrate. And oxidizing agents are bleaching powder, chlorine, hydrogen peroxide, iodine, tincture of iodine, iodoform, potassium permanganate, sodium hypochlorite. Reducing agents is sulfur dioxide. Sixth, antacids. Antacids are the medicines which neutralize the action acid present in the stomach. Stomach juice contains hydrochloric acid. This acid helps the process of digestion of food. Due to illness or anxiety or some other reasons, more acid is produced in the stomach. The stomach juices become more acidic than necessary. This causes problem in digestion, bleeding in the lining of stomach, or even ulcer. Some medicines are used to neutralize the excess acid and correct the pH of the stomach fluid. For example, sodium bicarbonate NaHCO3 or a suspension of magnesium hydroxide is used to neutralize excess of acid present in the stomach. Milk of magnesia contains magnesium hydroxide. Eno fruit salt contains sodium bicarbonate which helps to neutralize excess acidity in the stomach juice. Medicine like Digene, Gelusil used as an antacid contains magnesium hydroxide. Antimicrobials. Many diseases are caused due to the infection in the body by certain microorganisms, bacteria, fungus, or viruses. Some examples of diseases caused by microbes are dysentery, pneumonia, typhoid, urinary tract infection, etc. Antimicrobials are the chemicals which are used to kill microorganisms which has infected the body without causing much damage to the body of the patient. Thus, an antimicrobial is a chemical which is capable of curing diseases caused by the various microbes. An ideal antimicrobial should kill disease causing microbes and should not have any harmful effects on the patient. In fact, there may not be any such antimicrobial which is totally safe or without any side effect. The most common antimicrobial available are the sulfur drugs and antibiotics. Eighth, antibiotics. Antibiotics are the metabolic products produced by some microorganisms, mold or fungi. They inhibit growth and even kill diseases causing microorganisms like bacteria, fungi, etc. by inhibiting their life processes. Therefore, they are referred to as antibiotics. Anti means against and biotic means life. Penicillin was the first antibiotic to be discovered. Alexander Fleming isolated penicillin in 1929 from a mold Penicillium notatum. Penicillin has been used for the treating diseases caused by several bacteria. It has been effectively used for treatment of pneumonia, bronchitis, sore throat, abscesses, etc. Later on, attempts have been made to improve the quality of penicillin. It has led to the discovery of different variety of penicillin. For example, penicillin G, also known as benzyl penicillin, penicillin F, penicillin K are the more common varieties of penicillin. Ampicillin and amoxicillin are the semi-synthetic modifications of penicillin. In this case, the metabolic products of mold is obtained and then some reactions are carried out to bring the desired changes in the antibiotic molds to get ampicillin or amoxicillin. Attempts are being made to discover better and better antibiotics. This search for finding better antibiotics is never ending process. Now the large number of antibiotics are available. Some examples are streptomycin and chloromycetin, chloramphenicol and tetracycline. Streptomycin is used for the treatment of tuberculosis, that is TB. Chloromycetin is used for the treatment of typhoid. Tetracycline is used for the treatment of several diseases. Broad spectrum antibiotics are those antibiotics which kill a wide range of diseases causing microorganisms. Broad spectrum antibiotics can be used for the treatment of several diseases. For example, streptomycin, tetracycline, and chloramphenicol are broad spectrum antibiotics. Narrow spectrum antibiotics are effective in the treatment of a few diseases. 9. Allergic reactions of antibiotics. Some people may show allergic reactions to some antibiotics. These reactions may be mild, like rashes appearing on the skin, or may be very serious and can even be fatal. You might have observed that a doctor gives a small dose of antibiotic by injection and then waits for some time to watch if there is any unwanted reaction. If there is no adverse, that is bad reaction, then only the doctor gives the full dose of antibiotic. 10th, tranquilizers and hypnotics. Tranquilizers and hypnotics are used to reduce the anxiety and they also make a person calm. Sleeping pills are made up of these compounds. Most of them are habit forming. Their indiscriminate and overuse should be avoided, otherwise it may lead to the addiction and may other complications. Luminal, seconal and equinyl are the most commonly used tranquilizers. Barbituric acid and some other compounds related to barbituric acids are used in making sleeping pills. Fertility control medicines. It is a concern of everyone to control human population. Medicines are available which help prevent pregnancies. The medicines which help prevent pregnancies are called contraceptives. These are generally available in the form of tablets and are to be taken regularly by females. Chemicals like norethindrone and mestranol are used as contraceptives, that is birth control pills. Chemically, these are similar to female sex hormones. Birth control pills may have some side effects in some cases. Therefore, the birth control pill should be under the guidance of some expert. Hazards of self-medications. When medicines are taken by a patient without the advice of a qualified doctor, it is called self-medication. Self-medication is a very harmful and a dangerous practice. One should never try self-medication. Some of the harmful effects are First, a medicine which has worked well for someone may not be good for you and can even cause some serious harm. Second, you may take a medicine in quantity more than necessary. It may be harmful for you. Third, you may take quantities less than necessary. The disease causing microorganisms may gain resistance to the medicine and the medicine may become ineffective. You should know and avoid self medication. Without advice of a doctor, avoid the use of common medicines over prolonged period. Improper use of even most common medicines which are readily available without a prescription of a doctor can have harmful effects. The medicines which you can buy without a prescription of a doctor are called over-the-counter medicines. For example, cough syrups, crocin, aspirin, etc. are over-the-counter medicines. The medicines which you can buy after showing a prescription of a qualified doctor are known as scheduled drugs. Improper use of scheduled drugs is likely to cause more serious problems. Therefore, their sale is controlled and regulated by the government. Most of good chemists do not sell scheduled medicines without a proper prescription. Some irresponsible chemists may sell such medicines without a prescription. It is not a good practice. You should know and not chemicals in food, preservatives and artificial sweetening agents. Food preservatives. Chemical substances which are used to protect food materials against microorganisms, bacteria, yeasts, and molds are called preservatives. Some commonly used preservatives are: first, common salts, sugar, and oils. The sufficient amount of salt resists the activity of microorganisms in food and it is called salting. It is used to preserve raw mango, bean, fish, and meat, etc. Sugar syrup used for preserving like apple, mango, amla, and carrot, etc. Sugar, oil, vinegar, and citric acid are used to preserve pickles, ketchups, and jams, etc. Second, sodium benzoate, C6H5COONA. It is used for preserving the food materials like fruit juices, soft drinks, squashes, and jams. It is insoluble in water. It is metabolized as hypuric and which is excreted in urine. Third, sodium metabisulfite, Na2S2O5. Its preservative action is due to SO2, which form sulfurous acid when dissolved in water. It also inhibits the growth of yeasts, molds, and bacteria. It is used to preserve fruit jams, juices, squashes, pickles, apples, etc. Fourth, sodium and potassium salts of propionic acid, sorbic acid are also used as preservatives. Antioxidants. The unsaturated fats and oils are readily oxidized on storage. The taste and smell are changed and become rancid. To prevent this oxidation, rancidity, and spoilage, certain chemicals substances are added, are called antioxidants. When these are added to the food items containing fats and oils, retard the oxidation because they are more reactive towards oxidation than fats and oils. So the oxidation of food is prevented. Antioxidants react with free radicals and stop the oxidation of food. The most familiar antioxidants are butylated hydroxyl toluene BHT and butylated hydroxyl anisole BHA. These are added to butter, meats, cereals, chewing gum, snack gum, baked food, and beers, etc. It increases the life of food from months to years. It shows more active synergetic effects when added to vitamin C, ascorbic acid, and citric acid. Artificial sweetening agents. The chemical compounds which give sweetening effects to the food are called sweetening agents. Sucrose and glucose are widely used as natural sweetening agent. The excess intake of natural sugar causes the obesity, diabetes, and tooth decay. Natural sugar is a good source of energy, while the artificial sweetening agents does not provide energy. It is excreted from the body in urine exchanged. Some commonly used artificial sweetening agents are saccharin, aspartame, erythritame, sucralose, etc. First, saccharin. Saccharin is insoluble in water, but sodium salt is highly soluble in water. It is 550 times sweeter than sugar. It is not metabolized in our body, so it does not provide energy and has no calorific values. Aspartame. It is methyl ester of dipeptide derivatives derived from aspartic acid and phenylalanine. It is 100 times as sweet as sugar. It is unstable at cooking temperatures. It is used in cold drinks and soft drinks. It is an exception because the body breaks it down into amino acids and methanol. Third, elite. It is very high potency sweeter. It is about 2000 times sweeter than sugar. It is most stable at cooking temperatures. It is very difficult to control the sweetness of food. Fourth, sucralose. It is a trichloro derivative of sucrose. Its taste is like sugar. It is also stable at cooking temperatures. It is about 600 times sweeter than sugar. Sucralose is expected to become a great commercial artificial sweetening agent. So, the chapter is completed. Thank you.